Introduction. Nanotechnology has revolutionized the field of medical science, offering promising opportunities for targeted drug delivery to various body systems. In particular, the respiratory system presents a unique challenge due to its complex anatomy and physiology. This comprehensive course aims to provide medical students with an in-depth understanding of nanoscale drug delivery to the respiratory system. Through this script, we will explore various aspects including the anatomy and physiology of the respiratory system, different drug delivery routes, nanoparticle formulations, principles of inhalation therapy, targeted drug delivery strategies, pharmacokinetics, safety considerations, nanosensor technologies, challenges, future perspectives, and regulatory and ethical aspects. Additionally, we will highlight several case studies and clinical applications that demonstrate the potential benefits of nanoscale respiratory drug delivery. So, let's delve into this fascinating field and unlock the potential of nanotechnology in improving respiratory health. To comprehend the significance of nanoscale drug delivery to the respiratory system, let's first establish a clear understanding of what nanotechnology entails. Nanotechnology involves the manipulation of materials and devices at the nanometer scale, typically ranging from 1 to 100 nanometers. At this scale, the unique properties and behaviors of materials emerge, allowing for precise control and targeted drug delivery. In the context of respiratory drug delivery, nanotechnology provides numerous advantages. Nanoparticle-based drug delivery systems can enhance drug bioavailability, increase therapeutic efficacy, and reduce systemic side effects. These nanoparticles can be engineered to possess specific properties such as sustained release, controlled drug release, and targeted delivery, overcoming various hurdles encountered in conventional drug delivery approaches. A detailed understanding of the anatomy and physiology of the respiratory system forms the foundation for comprehending targeted drug delivery strategies. The respiratory system consists of multiple components, including the nasal cavity, pharynx, larynx, trachea, bronchi, and lungs. Gas exchange primarily occurs within the alveoli, which are tiny sacs present in the lungs. The alveoli have a large surface area and thin walls, facilitating efficient passage of oxygen and carbon dioxide. Moreover, the respiratory system is equipped with numerous defense mechanisms, such as mucus production and cilia, which help trap and remove foreign particles and microorganisms. Pulmonary drug delivery offers several routes for the administration of drugs to the respiratory system. These routes include inhalation, intratracheal instillation, and intranasal delivery. Inhalation is the most common and effective route for targeted respiratory drug delivery. Inhalation therapy involves the delivery of drugs in aerosolized form, allowing for direct deposition within the respiratory tract. The choice of inhalation device depends on the patient's ability to use it effectively and efficiently. Different devices include metered dose inhalers, MDIs, dry powder inhalers, DPIs, and nebulizers. Nanoparticles serve as carriers or delivery platforms for respiratory drugs. These nanoparticles can be composed of various materials such as lipids, polymers, or inorganic substances like metals and metal oxides. The choice of nanoparticles depends on the desired drug release kinetics, stability, biocompatibility, and targeting capabilities. Lipid-based nanoparticles, such as liposomes and solid lipid nanoparticles, SLNs, are commonly employed due to their biocompatibility and versatility. Polymeric nanoparticles, such as polylactic co-glycolic acid, PLGA, particles, offer controlled drug release and tunable properties. Inorganic nanoparticles, such as gold nanoparticles, possess unique optical properties that enable imaging and diagnostic applications in addition to drug delivery. Understanding the principles of inhalation therapy is crucial for efficient drug deposition within the respiratory system. Upon inhalation, aerosolized drug particles encounter various mechanisms that determine their deposition pattern. Particle size plays a key role in determining deposition location. Larger particles tend to deposit in the upper airways, while smaller particles can penetrate deeper into the lungs' alveolar region. The deposition pattern is further influenced by factors like particle shape, density, and airflow dynamics. Optimization of these parameters ensures targeted drug delivery to specific lung regions affected by respiratory diseases. Targeted drug delivery strategies aim to deliver therapeutic agents to specific sites within the respiratory system, thereby maximizing therapeutic efficacy while minimizing systemic side effects. Several strategies have been developed to achieve this goal. One approach involves the functionalization of nanoparticles with ligands or antibodies that recognize specific receptors present on target cells or tissues. This ligand-receptor interaction facilitates the selective uptake of nanoparticles by diseased cells while sparing healthy ones. Another strategy relies on exploiting the enhanced permeability and retention (EPR) effect, which takes advantage of the leaky vasculature in disease sites to enhance nanoparticle accumulation. Understanding the absorption and pharmacokinetics of respiratory drugs is essential for optimizing their therapeutic efficacy. Following pulmonary drug delivery, drugs can be absorbed through various mechanisms, including passive diffusion, active transport, and endocytosis. Once absorbed, drugs can enter the systemic circulation or act locally within the respiratory system. Pharmacokinetic parameters, such as the rate and extent of drug absorption, distribution, metabolism, and excretion, influence drug efficacy and safety. These parameters can be modulated by nanoparticle formulations to achieve desired therapeutic outcomes. The safety and toxicity aspects associated with nanoscale drug delivery to the respiratory system must be carefully evaluated. Nanoparticles can potentially induce adverse effects due to their small size, unique physicochemical properties, and prolonged tissue residence. To ensure patient safety, nanoparticle formulations undergo rigorous toxicity assessments, evaluating parameters such as cell viability, tissue compatibility, genotoxicity, and immune response. Regulatory bodies have established guidelines to monitor the safety profile of nanomedicines, promoting their clinical translation while minimizing potential risks. Monitoring and assessing the effectiveness of respiratory drug delivery systems are crucial for optimizing treatment outcomes. Nanosensor technologies offer promising capabilities in real-time monitoring of drug distribution, release kinetics, and patient compliance. Nanosensors can be incorporated into inhalation devices or used as separate systems to measure drug concentrations at specific sites within the respiratory system. These sensors employ various detection mechanisms, such as fluorescence, surface plasmon resonance, or impedance-based sensing, allowing for precise and continuous monitoring of drug delivery parameters. Despite significant advancements, several challenges persist in the field of nanoscale respiratory drug delivery. Effective targeting to specific cells or tissues, overcoming mucociliary clearance mechanisms, stability during aerosolization, and mass production of nanoparticles are some of the challenges that need to be addressed. Future perspectives hold the promise of personalized medicine, where patient-specific factors are considered for tailored drug delivery. Furthermore, the development of smart inhalers, integration with digital health technologies, and advancements in nanomaterial engineering may revolutionize respiratory drug delivery, transforming the management of respiratory diseases. The introduction of nanomedicine in respiratory drug delivery raises important regulatory and ethical considerations. Regulatory bodies worldwide play a critical role in evaluating the safety, efficacy, and quality of nanomedicines. Proper labeling, manufacturing standards, and clinical trial protocols are essential for regulatory approval. Ethical aspects encompass concerns related to patient privacy, informed consent, equitable access to nanomedicines, and potential consequences of nanomaterial exposure. Transparent communication between healthcare professionals, researchers, regulatory authorities, and patients is crucial to navigate the ethical landscape of nanomedicine. Case studies and clinical applications serve as valuable examples for understanding the practical implementation and impact of nanoscale respiratory drug delivery. We will explore noteworthy case studies that highlight the successful translation of nanomedicines into clinical settings. These case studies will encompass various respiratory diseases, including asthma, chronic obstructive pulmonary disease, COPD, lung cancer, and respiratory tract infections. By examining the outcomes and challenges encountered in these studies, we can gain insights into the future potential of nanomedicines and respiratory therapeutics. In conclusion, the field of nanoscale drug delivery to the respiratory system presents immense potential for improving the management of respiratory diseases. Through this script, we have explored various facets, including the anatomy and physiology of the respiratory system, different drug delivery routes, nanoparticle formulations, inhalation therapy principles, targeted drug delivery strategies, pharmacokinetics, safety considerations, nanosensor technologies, challenges, future perspectives, regulatory and ethical aspects, and case studies. As medical professionals, it is crucial to stay abreast of the latest advancements in nanotechnology and its applications in respiratory drug delivery. Embracing these innovations can significantly enhance patient outcomes, optimize drug therapy, and pave the way for personalized medicine in the realm of respiratory health. Let us continue to explore, innovate, and unlock the potential of nanotechnology for the betterment of respiratory healthcare.